Hello everyone, this is Trudy Chen. Today we are going to learn about applying and removing personal protective equipment. After this session, you are able to, first, to define standard precaution and personal protective equipment. Second, to demonstrate the steps for donning and removing PPEs. The protection of healthcare personnel from infectious disease exposures in the workplace requires a combination of controls. Standard precautions is applied to prevent the transmission of infectious microorganisms to healthcare personnel, patients, and visitors in a healthcare setting. Personal protective equipment, PPE, is defined as specialized clothing or equipment worn by an individual for protection against infectious materials. PPEs listed here prevent contact with the infectious agent or body fluid that may contain the infectious organisms by creating a barrier between the worker and the infectious material. Gloves protect the hands. Gauze or aprons protect the skin and or clothing. Masks protect the mouth and nose. Goggles protect the eyes. And face shields protect the entire face. PPE selection, or the combination of PPE, is determined by the category of isolation precautions. Employers must provide their employees with the appropriate PPE and ensure that PPE is disposed or, if reusable, is properly cleaned or disinfected, repaired, and stored after use. Under standard precautions, gloves should be used when touching blood, body fluids, secretions, excretion, or contaminated items, and for touching mucous membranes and non-intact skin. A gown should be used during procedures and patient care activities when contact to clothing and or exposed skin with blood, body fluids, secretions, or excretions is anticipated. Gloves are the most common type of PPE used in healthcare settings. Most patient care activities require the use of a single pair of non-sterile gloves made of that lactose, nitrile, or whale. However, some facilities have eliminated or limited latex products due to allergic concerns. Gloves protect you against contact with infectious agents. However, once contaminated, gloves can become a source for spreading infectious materials to yourself, other patients, or environmental surfaces. Change gloves as needed. If gloves become torn or heavily soiled and additional patient care tasks must be performed, then change the gloves before starting the next task. Always change gloves after use on each patient. Discard them in the nearest appropriate receptacle. Be sure to select the type and size of glove needed for the task that best fits you. Insert each hand into the appropriate glove and adjust as needed for the comfort and dexterity. If you are wearing an isolation gown, tuck the gown cuffs securely under each glove. This provides a continuous barrier protection for your skin. Using one gloved hand, grasp the outside of the opposite glove near the wrist. Pull and peel the glove away from the hand. The glove should now be turned inside out, with the contaminated side now on the inside. Hold the removed glove in the opposite gloved hand. Slide one or two fingers of the ungloved hand under the wrist of the remaining glove. Peel glove off from the inside, creating a bag for both gloves. Discard in waste container. Selection of gown depends on the purpose. Isolation gowns are generally preferred. If contamination of the arms is anticipated, a gown should be selected. Gowns should fully cover the torso, fit comfortably over the body, and have long sleeves that fit snugly at the wrist. Clean gowns are generally used for isolation. Sterile gowns are only necessary for performing invasive procedures. To don a gown, first select the appropriate type for the task and the right size for you. The opening of the gown should be in the back. Secure the gown at the neck and waist. If the gown is too small to fully cover your torso, use two gowns. Put on the first gown with the opening in front, and the second gown over the first with the opening in the back. Unfasten the gown ties with the ungloved hand. Slip hands underneath the gown and the neck and shoulder. Peel away from the shoulders. Slip the fingers of one hand under the cuff of the opposite arm. Pull the hand into the sleeve, grasping the gown from inside. Reach across and push the sleeve of the opposite arm. Fold the gown towards the inside and fold or roll into a bundle. Only the clean part of the gown should be visible. Discard into waste or linen container as appropriate. Some masks are fastened with ties, others with elastic. If the mask has ties, place the mask over your mouth, nose, and chin. Fit the flexible nose piece to the form of your nose bridge. Tie the upper set at the back of your head and the lower set at the base of your neck. If a mask has elastic head bands, separate the two bands. Hold the mask in one hand and the bands into the other. Place and hold the mask over your nose, mouth, and chin. Then stretch the bands over your head and secure them comfortably as shown. One band on the upper back of your head, the other below the ears at the base of the neck. Adjust the mask to fit, and make sure it is secure on your head and fits snugly around your face so there are no gaps. The front of the mask is considered contaminated and should not be touched. Remove by handling only the ties or elastic bands, starting with the bottom, then top tie or band. Lift the mask away from the face and discard it into the designated waste receptacle. If eye protection is needed, either goggles or a face shield should be worn. Position either device over the face and/or eyes and secure to head using the attached earpieces or headband. Adjust to fit comfortably. Goggles should feel snug but not tight. Using ungloved hands, grasp the clean ear or headpiece and lift away from face. If goggle or face shield are reusable, place them in a designated receptacle for subsequent reprocessing. Otherwise, discard them in the waste receptacle. Here are some tips about PPE use. Don it before you have any contact with the patient, generally before entering the room. Once you have PPE on, use it carefully to prevent spreading contamination. When you have completed your task, remove the PPE carefully and discard it in the receptacles provided. Then, immediately perform hand hygiene before going on to the next patient. To remove PPE safely, you must first be able to identify what sites are considered clean and what are contaminated. In general, the outside front and sleeves of the isolation gown and outside front of the gloves, goggles, mask, and face shield are considered contaminated, regardless of whether there is a visible dirt. The areas that are considered clean are the parts that will be touched when removing PPE, including inside the gloves, inside and back of the gown, the ties, the elastic or earpieces of the mask, the goggles and the face shield. That's all for today. Thank you. Here are the references.